In this video, we're taking a look at EMDR in the treatment of adult survivors of childhood sexual abuse. This is the initial assessment session, and our focus in this session is history taking based on EMDR, identifying targets, and the timeline. We are also taking a look at some of the challenges that do appear in our treatment sessions with clients with a complex history, which includes safeguarding issues. We are also trying to highlight how EMDR can be used as a short-term intervention, even with clients with a complex history.
I had a panic attack on my way home. I had another 4 over the week. I'm only getting 3 hours sleep, and even that's broken. I just wake up in a panic, and I don't know why. I mean, like I said last week, I've been having these problems for as long as I can remember. And CBT is helpful in the past, but it's just not working anymore. I don't think it's a solution. I've been in therapy on and off now for the last 15 years. Don't do anything. I just stay in the house. And yes, I can cook. I can do the dishes, but the house is a mess.
Sounds like things are really difficult for you this time. Sounds like things have worsened over the few years. From our conversation last week, you mentioned that you've been experiencing anxiety, panic attacks, and depression for over 20 years, and that you've been on medication on and off. I'm just wondering, for you, what made things worse? What really brought about this significant change?
I think it was last October during a session. I was talking about my nan, and I had this memory, like a flashback of something that happened at her house when I was 4 years old. My uncle was there with his children, but I'm not sure if it ever actually happened, if it's real or if it's a dream. But I've been having more flashbacks, so it's like it happened more than once. I don't know, it's hard. It's hard to believe that my uncle would do that.
If it's okay with you, can you just tell me what you remember about your experiences with your uncle? Not too much information, just the bit that you can. I don't want you to be distressed, so we're not going into too much information today. Just the basic that you can share with me, if it's okay with you.
So this is the thing. When I tried to tell my other therapist, she wanted to know what I could remember so she can make a report to the police. And I told her I don't remember anything. It's hard, even if I did have a memory of it, I don't think I would want it reported. It would just destroy the family. My mum's very close to her brother, my uncle, and I'm very close to my cousins. They've been really supportive over the years, and I've been struggling. Stop going there because of this pressure of them wanting to report it to the police. I can't do that. Just can't. My uncle's a church vicar, and he's very well respected in the family and in the community. No one would believe me. I just want to get better. That's all. Things are bad for me as it is without creating more problems for myself. Please don't put me under pressure with this.
That's okay. I understand your apprehension about it. Maybe we can revisit this in the future. I guess for now, I think the most important thing is to find the right treatment for you. A treatment that can help you with these difficulties you're experiencing. Just tell me a little bit about what you remember about this incident, if that's okay with you.
I just remember when I was at my grandmother's house. She looked after me and my brother when my mum was at work. And my two cousins used to be there too. My uncle had dropped them off. I get this flashback of him taking me upstairs and he pulled his trousers down and showed me his bits, his penis. I don't know much.
Linda, we don't have to go into too much detail. Just a snapshot of what you remember. And again, if it's too much for you, we can leave it for now. How are you feeling right now? Do you want us to continue?
I'm okay.
But if it's becoming too much for you, we can leave it for now. How are you feeling right now? Good.
Thanks. Well, I was thinking you were going to put me under the same pressure I had at the NHS. It was difficult for me to continue treatment. It felt like it was more important for them to report for the police.
I do appreciate how hard this must be for you. I guess for now, what we need to do is to focus on helping you get better. How does that sound?
Yes, that's fine.
If that is fine with you and you're okay to continue, again, without going into too much detail, just tell me what you can remember.
It's like a dream. Nothing seems real. I think he put me on the bed and was rubbing his penis on my genitals. Sorry, I don't really know. My uncle was nice to me when I was young, and he used to buy me presents for birthday and Christmas. I feel really bad talking about him this way. I just want to get better.
So you mentioned two memories that you have. One of them is when he showed his penis, and the other one when he rubbed his penis on your genitals.
I think he inserted something into my mouth. And he was moving my head.
So, was that again at your grandmother's house?
Yes, everything happened at my grand's house.
So, Linda, are there other memories about your uncle in addition to the ones that we've talked about?
I was in pain. And I remember seeing blood and crying. He took me to the bathroom to wash me. And he said we'd been playing a game and I'd had an accident. I do remember him saying not to tell anyone. It was our secret game. And he would make sure it didn't hurt next time.
So how old were your uncle's children?
They were all older than me. I think one is 6 years older and one is 9. So they would have been 11, 15 at the time. I must have been 4 or 5.
So, Linda, when did this episode start? I know that you said you have suffered from these difficulties for over 20 years, but you also said that this episode has been very severe and very intense, and you mentioned that nothing's helping to shift things off. What do you think started things off for you this time?
My gran died in 2015. I was living in London at the time and had to come home for the funeral. I didn't cope well. I tried to go back to London, but I was struggling with low mood and anxiety. And I was having panic attacks nearly every day. So I decided to move back up to Wigan to be near my mother and my sister. My other therapist said I was suffering from complicated grief. And she taught me some meditation and some CBT focused on my bereavement. And she encouraged me to write things down. More recently, I've been using Headspace, but nothing I do now seems to work. I just feel so fragile and frightened all the time.
So, Linda, could you tell me a little bit about the panic attacks and what tends to trigger those panic attacks for you?
I'm always hypersensitive when I'm out of the house. It just feels as if I'm going to be attacked. And my anxiety tends to go up if I see men in blue jackets or jeans. Don't know why. I don't like crowded places. And I don't like going out when it's dark. It just feels like someone's watching me or following me. And now it's starting to feel like someone's watching me when I'm in the house. I don't feel safe to be alone in the house. But likely my mother's there most of the time. I'm not sure if this is related, but I find it difficult being around men, even at work. So I try to avoid interacting with them, and it's causing problems. My manager is a man, and I try to avoid him. I've even been phoning in sick every time I have to have a meeting or a review with him, and even suggesting we do it over the phone. But he's starting to wonder why, and he's insisting that our next meeting is face-to-face. And the thought of that just terrifies me. Just talking about it is giving me anxiety. I might end up losing my job. I think they might let me go soon. But also I think I might even have to give up work, just because I'm just so exhausted all the time. It's just all so tense. And I'm feeling anxious. It's such hard work. And this is my immediate worry. It's something I need to deal with right now. I want to be able to at least go into work and manage my anxiety. And my manager is now insisting that our next meeting is face-to-face in a closed office. And I am just terrified of that. I really don't think I can do that at the moment. I honestly don't know what to do.
That's okay. Once we've finished this history taking, we'll talk about how we can proceed with treatment. For now, I just want to understand things a bit better so we can have a shared understanding of your difficulties. And as a team, we can then decide how to proceed. How does that sound to you?
Yes, I understand you need to have some information about me. I know it's hard for me to talk about these things. And I know I do have other problems in my relationships.
In what way?
When I moved to London, I moved in with an older man. And he was very nice and charming in the beginning, but things changed. He was very controlling, always putting me down. Then he became physical with me. He would physically assault me. And he would ask me to do things disgusting. I felt so small and dirty, not even human.
So how long were you in this relationship?
I tried to leave. My sister asked me why did I stay if things were that bad, but he would threaten me. I remember one time he had me pinned up against the kitchen wall with a knife in his hand. He had some really bad guys around him. And he forced me to smoke cannabis and cocaine. And I only managed to leave when the police got involved. That was 2 years.
How did the police get involved?
He attacked me. The neighbours managed to call the police, and I got an injunction on him for a year. But that's due to run out in September, so if I want to get it extended, I'm going to have to go back to court. And at this point in time, I don't think I'll be able to stand up in front of a judge and give evidence. Some way, I think I'm just like my mum, you know? This is how my stepfather was with my mother. Very abusive.
Can you tell me, how old were you when you started living with your mother and stepfather?
I think it was about the age of 3 or 4. Can't really remember. I've got this vivid memory of waking up and hearing my mother crying. And I rushed into her bedroom and she was on the floor. And my stepfather had his foot on her chest. And he was shouting at me to get out of the room. I remember being so scared, thinking she might die.
How do you feel about yourself when you think about this memory?
I feel really sad. And in some way I feel helpless and weak. I feel like I should have done something. And run to the neighbours for help or screamed for help, but I was too terrified.
Okay, what other memories do you have of your stepfather that would represent your feelings of being disturbed by him?
When I was about 7, he dragged me by my hair because I was still watching TV at 8:30 and I was supposed to be in bed at 8 o'clock. And he pulled me by my hair all the way upstairs to my room.
Are there other memories with your stepfather?
No. No, these are the most significant ones I remember.
What about in relationship to mother?
The only memory is the next day after that fight. My mum stayed in bed the whole day. Probably the whole week. She couldn't walk. And she was crying all the time. I was worried about going to school and leaving her on her own. I was worried that she might die or that something bad might happen.
Are there other specific memories that you have where you felt vulnerable, not good enough, powerless, and having the feelings of being trapped?
When I had my first boyfriend, Luke, I was 14. We were dating for a couple of months and then he started seeing another girl in our class and he told everybody that I was boring because I wasn't willing to do interesting things. I just wasn't ready for sex. I guess it made me feel as if I wasn't good enough. And I felt that way when I was in London. But also in London, I felt like I was powerless and trapped, and I don't know really how I felt.
So how old was Luke then?
I think he was 16, 17, not sure.
So it sounds as if from the experiences that we have talked about, you developed the idea that you're weak, powerless, and not good enough.
I guess so. But I just feel so vulnerable as well, like as if I'm in danger. I've been feeling like this ever since I started having the flashbacks.
So for you, what else reinforced the feeling of vulnerability?
I think the situation in London didn't help at all. I really felt vulnerable when I was in London, and I still feel that way now because the court injunction's only temporary.
Are there other specific memories that you have where you felt vulnerable, not good enough, powerless, and having the feelings of being trapped?
I don't think so, no.
So, Linda, you have told me that you've been in therapy on and off for many years now. I just want to check with you, if that's okay. What did you find to be helpful or beneficial? I mean, what are some of the benefits that you've gained from your previous therapy treatments?
The meditation was helpful until now. In the past, I've been able to question my thoughts. It's a technique I learned during CBT. But it's just so difficult now. I'm really struggling. Especially at night, I have this anxiety that's hard to shift. And I'm just not sleeping. And if I do manage to get to sleep, I'll wake up in a panic. I don't know why. And when I started having these panic attacks, I thought it was because of my grandmother's death. But now after therapy, and I'm still having the attacks, and they're actually getting worse. I don't know really.
So you mentioned feelings or thoughts regarding vulnerability, powerlessness, and being weak. You also talked a lot about a feeling of not being good enough and a sense of being in danger. Is that still there for you?
Yeah, it's still there. I guess the biggest one is of feeling weak. And I just feel so vulnerable.
So for you, what else reinforced the feeling of vulnerability?
Situation at work with my manager. I just feel so vulnerable to go into these one-to-one meetings with him. It's this feeling of being weak and maybe not being able to protect myself. I don't know why. My manager's been really good, He's been really accommodating. He did the monthly reviews over the phone until... He doesn't know why I've been avoiding them.
Let's say from your childhood and beyond, if we were to cluster them, would you say you got the message from your stepfather? Is it from your uncle? Or is it more from your mother?
I think more from my uncle and my stepfather. And maybe from my mother, from seeing her so battered and bruised that she couldn't get out of bed.
So, Linda, if we are to proceed with treatment, how will you know that we're done? I mean, what is going to be different from how things are right now for you?
To be able to have face-to-face meetings with my manager. That's more important at the moment. And I want to feel less vulnerable and powerless. And I want to get rid of the panic attacks and the anxiety. And to be able to sleep well again.
Anything else?
I would like to be in a relationship. But now I just don't feel good enough for anyone. I was hoping we might discuss treatment options today. I've tried CBT, but I don't think it'd be helpful right now. Dr. Nadine mentioned schema therapy. I don't know much about that.
So, Linda, I've got experience of working with my clients in many different ways. And in your case, and the history that you have shared with me, there are two main ways that we can work together to help you resolve these traumatic memories. One way, we could talk about it, and talk about it, and talk about it. That way, we'll be using CBT or schema therapy. Schema therapy is a form of CBT. The word schema refers to core beliefs that we've talked about, such as your beliefs of being weak, not good enough, and the belief of vulnerability that you talked about. And you also mentioned the belief of being trapped. This way include interacting with your memories in other ways. The point is, we need to keep interacting with it in ways that are now different from those you are used to. Now, over time, this can help you change your relationship with these memories, and they might feel a little bit less intense and maybe a bit manageable. Alternatively, we can just use EMDR, which is less talking, working with the memory, just working through the body and the brain direct, which is more of emotional therapy than talk therapy, that is CBT and schema. Is that making sense so far?
Yeah, I understand that. So how does EMDR work then?
Okay, so EMDR involves holding a traumatic memory in your mind's eyes and simply notice your response to holding that memory. Every 30 seconds or so, I will check in with you and ask what you're noticing. All you need to tell me is what you're noticing at that time, and we'll continue until the disturbing memory is no longer distressing. And again, this way does not require a lot of talking. This way you can work much faster than the CBT and schema way. Now, the strange thing about this EMDR therapy is that it involves some form of left and right brain stimulation. We can do a mix of CBT and the noticing therapy, which is EMDR, if that's okay with you. What do you think?
That sounds interesting.
Initially, when EMDR was developed, if you can just, when I put my fingers like this, if you can just follow my fingers from left to right.
Mm-hmm.
So initially, we used to use our fingers like this. Yeah, just your eyes, just follow with your eyes. So we're kind of stimulating the right side of the brain and the left side of the brain, just helping the brain's natural information processing to take place. Yeah?
Okay.
Now, in addition to using the hand and the fingers, we also use the machine. It works the same way. So I'll show you how this works. So I'll just turn it on now for you. Okay. As you see those moving lines from left to right?
Yes.
If you can just follow that with your eyes. So we've just replaced the fingers moving in front of you and you using this. The same process, just helping the brain's natural information processing to take place, just facilitating it for trauma healing. Yeah.
Mm-hmm.
In addition to that, we also use this. So I've got different choices. So if you just hold it like that, can you feel the vibration from left to right?
Yeah.
It's the same process. It's gentle trauma therapy. It works with the brain and the body.
Okay.
So it's kind of more of emotional trauma therapy in that sense. What are your thoughts?
I've never heard of this. But, it's interesting. I'm willing to try it if you think it will help me.
Yeah, it does help.
Now, reviewing all the information that we've shared today, and also just bearing in mind that we've got only 12 sessions approved at the moment, and we need to ensure that we utilize these sessions to your benefits. With that in mind, in order to make your life better, I just want you to have a think which of these memories do you think need to be processed or fixed first? I mean, which memory causes you the most disturbance or distress right now?
I'm not sure about that at the moment. I'll have to think about it.
How about doing it this way? Only if it's okay with you and you can manage the distress. How about, as part of your homework, to make a list of highly charged, disturbing memories, starting with the ones that we've talked about today. So if you could make a list of 5 to 10 disturbing memories, this could be over a lifetime, but also could include the situations and events that happened in London. The reason why we're doing this is because we've got limited number of sessions, 12 sessions. Therefore, we need, as a team, to identify memories which are crucial in understanding your difficulties, so we can target the right memories that will provide adequate relief from your current symptoms. How do you feel about doing that? Now, remember, one nice thing about EMDR, you can't do it wrong. Do you have any questions before we end for today? Great. So shall we meet same time next week?
Yeah, that'll be fine.